The meeting of the Public Safety Committee is now called to order. Madam Clerk, would you please call the roll?
Alderman Boyd,
Present.
Alderman Vaquero, Alderman Cone, Alderman Ornowitz. Here. Alderwoman Hubbard, Alderman Kotar, Alderwoman Spencer, Alderman Muhammad,
Present.
Alderwoman Boyd, Chairman Kennedy.
Here.
You have 4 present.
Please,
Alderman Vaccaro is
if Vaccaro is here, he's just on the other side.
Ways and Means.
Please excuse Cone and Alderwoman Boyd.
So noted.
Thank you. We have here today the Coalition Against Police Crimes and Repression to discuss with us revisioning public safety. They initially made us a small presentation of this during the budget process when there was the public input hearing that was over at the library downtown here. And I thought that it would be a good session for a public safety committee to see and to hear their thoughts about new ways and different ways of visioning public safety and how to spend those dollars. Jamala Rogers will start us out here, and they have a PowerPoint presentation.
Good morning to the Public Safety Committee, and thank you for giving us the opportunity to actually expand what we did for you earlier. We think that this is an important juncture in our city's planning, particularly around public safety. And so we've done quite a bit of work. And by we, I mean the Coalition Against Police Crimes and Repression, which was founded in 1983 after the killing of Marilyn Banks. And we've been together basically ever since, and looking at ways not only to hold the police accountable, but how do you invest in public safety in a way that benefits our citizens in our community. So I have here not only myself, I'm the co-chair of the Coalition Against Police Crime and Repression, but I have 3 other of my colleagues here that would help me with this. So re-envisioning public safety is the part that I think we shared with you all. And we went across the city looking at and engaging citizens around what they thought public safety was. And for a number of them, they thought it was merely the presence of police. And so after we took them through a number of activities that really looked at how much money the city spends on public safety, and that's including jails, courts, police, the whole realm, we saw that we are spending a whole bunch of money and not getting our money's worth for that. And so it was really an aha moment for a number of our citizens. And so the second piece of what we engaged them in was, if we had a slice of that amount of money that we spend on public safety, and citizens could say what that money could be used for, what would you say? And you know, we were both inspired and surprised at what citizens came up with. I mean, they didn't come up with, oh, we'd like to take our families down to the Bahamas for a trip. They came up with stuff like, we need more rec centers for our kids, we need better housing, we need some mental health services that are more accessible. So they were very concrete and very real. And so we then began to take that information and look at, okay, now we need to make a shift. People are clear on what we're spending. How can we then talk about the reinvestment piece of it, which is a natural flow from re-envisioning? So we've been looking at this. I said we've been around since 1983. We're the group that gave leadership to getting local control of the St. Louis Police Department, the establishment of the Citizens Oversight Board. And so those things are all helpful. They involve citizens, but we need to do a lot more. So when we talk about the arrest and incarceration model, we've looked at not just what's going on here, St. Louis County, but all over the country. And there's a heavy investment in law enforcement. And as I said, to the tune of not getting the best for our buck, because when we look at, for example, what we're arresting people for. And there's a quote there by Mayor Slay in 2016 about the crackdown on loud noises, speeding, public urination, all of that. Those are not exactly the kind of things that people are worried about. They need to be dealt with, but if somebody gets a ticket for littering and get hassled for loud noises, that creates a whole nother dynamic. So some of you all might have saw, I did a series of articles for the St. Louis American as we went into this midterm elections, and one of them was around marijuana, and I was asking people to help me develop or help my view on marijuana evolve, because what I saw was the incarceration rate for blacks was way out of kilter. And it's not just in St. Louis, but all over the country. And even if we legalize marijuana, it's still illegal federally, and we still got that hole where black folks would then still be subject for arrest. So we got 18 times more likely for black folks to be arrested for marijuana possession. And even though I think even from the board, there has been some attempts to lower that threshold, but at this point it's still illegal. And I think this comes not only from the ACLU study, but also there's a annual report from the AG's office that talks about this issue. So when we look at what's not working, and we see it every time we turn on the evening news, like what happened with a carjacking here, what happened with somebody coming up, taking stuff off people's porches, that kind of thing. But this represents like some of the more serious crimes, and in particular, some of the more violent crime is up. And so that's definitely raised people's sensitivities as well as their hypersensitivity to what it means to be in a community where that kind of violent crime is happening, and you're feeling helpless and you're trying to figure out what it is. And again, people think that the presence of the police is going to help that, and so we need to always try to get to the root causes of that. So right now, and this is, a national study, St. Louis is 11th highest in policed communities. So we have enough police officers to do what they need to be doing. That's pretty high, 11th for a city of our size. And so, so obviously adding more is not going to be the solution. So if we go by what the current projections are for officers, that's going to rank us 6th nationally. Yet people in our community still are saying they don't feel safe. There's people in the communities that look like me that say even when they call the police and they don't come, what does that really mean? Because isn't that what police officers are supposed to be doing? So we got some gaps between what police officers are supposed to be doing and what they do and how they do it in different communities. So I'm going to just have you put them all up there. There's some slides, and there's another one. So one of the things we try to do is to map out what our money is spent for in terms of the general revenue fund. And one of the interesting things is the police department budget. And we understand that they're still getting used to being under local control, where everything should be more transparent, particularly to a body like this. But we found it very difficult to even get the real numbers for what the police department is spending. We've gotten it through Sunshine Act and through some other means, but we don't think this should be a hidden budget in terms of people being able to do what they want to do with that money. But here's the general revenue fund and how much we're spending in relationship to public safety, look at what we're spending on health and human services, recreation, those kinds of things. So the big pie chart is definitely all out of kilter. So the arrest and incarceration model here, and this is for the 2019 fiscal budget, I do believe, we got like 267 million that we're using for that, for all of that. And that's almost half of the budget, 52%. And so how can we look at reassigning, reallocating those funds so that we really do have public safety. And public safety is not just about adding more police officers to the equation, but actually attempting in some real way to address the various needs of communities and families. And as I said before, people are looking for accessible housing, health care, particularly mental health. They're looking for living wage jobs. So those are the things that help bring down the numbers for crime. So I just want people to remember 52% is what we're spending, and how can we look at that overall budget and start to really look at how we're going to make it function for the city. The next person that should be coming up, Keith Rose, is going to take the next few slides.
Thank you, Jamala. Oh, I think that was also one of Jamala's slides, but that's fine. So looking now at the imbalance that Jamala had just mentioned to us.
Would you identify yourself?
Oh, I'm sorry. My name is Keith Rose. So looking now at this slide, as Jamala was just referring to, we have this distorted imbalance in the amount of money that our city is spending on policing and what we are spending on the programs and resources that are shown to actually prevent crime. And some of those, for example, are the school programs and summer jobs, building demolition, recreational programs, social work, and mental health. And those have been shown across the country to be instrumental in preventing crime and not just addressing crime on the back end. You can go ahead. And so when we talk about this preventing crime versus addressing crime on the back end, we often see public safety as something kind of like solving crimes after they're done. But it's really important that we start to envision public safety more like we think of fire resources. So we know it's important to put out fires, but we also know it's important to prevent fires. And so having this proactive approach as opposed to a solely reactive approach is going to dramatically increase safety here for the city of St. Louis. And so instead of looking at public safety as crime response, I encourage you to start looking at the original meaning of the phrase public safety, right? Safety for the public, which has many forms. And so looking at it on a more holistic approach, we can start to address the problems. Yes, and so if you could advance the slide. Thank you. And so this holistic approach to public safety addresses not only the violent crimes that we talk about so often, but also all of the other aspects of what makes a community and a person safe. And we know that people don't feel safe if they don't have a job. People don't feel safe if they don't have housing. People don't feel safe if they don't have health care. Holistic public safety includes things like in a city where asthma rates are disproportionately high compared to the rest of the country, public safety is having clean air so that our children are not being hospitalized. And it's important that we, as people interested in public safety, understand that as under our mandate as well. So when we look at when we look at these other things that can go on, like shelter and transportation, it's important to also realize the benefits of addressing these are not just in crime prevention. So a dollar that would be spent on what researchers call arrest and incarcerate model of policing could instead be spent on holistic public safety, meaning that not only do you get $1 worth of crime prevention, you also get these added benefits like actual housing and actual health care. And so in that way, our money goes further. You could advance, thank you. So instead of simply arrest and incarceration, we need a whole network of essential services and resources in order to achieve the true public safety for all of our communities. Shown here are many of the intersecting institutions and community pillars that are connected in across St. Louis. And these are what we would need in order to implement holistic public safety in our city. By strengthening these resources and the connections between them, we can create an effective public safety net for St. Louis. This holistic public safety net can catch and hold up our most vulnerable populations and keep them from falling into the unsafe conditions that lead to unfavorable outcomes, including criminality. And so in this way, by enacting a holistic public safety approach, we can actually be stopping crimes on the front end, as well as getting these other beneficial outcomes. Go ahead. Thank you. And so it's really important when talking about any of these issues to recognize who is unsafe and understand and remember that in St. Louis there is a dramatic disparity. So I'm sure you're all familiar with Dr. Jason Purnell's study For the Sake of All and all of its dramatic and horrible findings. And so just some of them being highlighted here is that a child born in Clayton can expect to live 18 years longer than a child born in Jeff Vanderloo. And so what does that mean for public safety? And that's not just gun crimes, right? That's all kinds of aspects of their safety. And so it's important to address this disparity and to acknowledge that there's many disparities in St. Louis in the way we allocate our resources. And so we need to make sure that the money that we're putting into these programs is being put in an equitable way. Go ahead. And now John Chasnoff.
Hey, y'all. I'm John Chasnoff. Thank you for letting us speak today. So if you could go to the next slide. So we have been doing this project of re-envisioning for several years now, as Jamala said, taking it around to the community. But in the end, we don't want to just re-envision public safety. We really think that city budgets reflect people's priorities, and so we want to reinvest in public safety. And so this next section is going to be a little bit about some of our initial ideas here as we advance this forward, some of our initial ideas around where some of this money might go, and a couple ideas where it might come from. So how do we actually reinvest? There was a study in Baltimore, and I'm sorry the slides are hard to read in this context, but you do have handouts, I think. Did you give the handouts?
Yeah, we gave the handouts out on Friday.
Okay.
But this is slightly different than what we...
Most of the slides are the same. There's some changes, but if you look at the handouts you have, you'll have some of this information later on to look at. But anyway, there was a study done in Baltimore, and what they did was they looked at the neighborhoods where incarceration comes from. So what are the neighborhoods where most incarcerated people come from? And what they found was that those were the same neighborhoods that were severely lacking in services. And so their conclusion was that these particular communities that had high incarceration rates were ripe for reinvestment, that these were the types of places where a city could get the most for its money if it were to put money back into those neighborhoods. And so just like in Baltimore, St. Louis needs to invest in some neighborhoods more than others. And the concept here is not equality of investment, but equity and outcomes. So what we want is equity and outcomes, equal outcomes, and that's going to require more investment in the neighborhoods that need it most. Some of the ideas behind this are that one of the ways we could take a step forward is to reduce what we are calling poverty-based criminalization. So that would involve reducing the population at the workhouse by ending the war on drugs and by getting rid of cash bail. And if we reduce the population at the workhouse, just by that one step of cash bail alone, we can start to imagine actually closing the workhouse and transferring the few remaining prisoners other places. That would save the city huge amounts of money and allow for some of this reinvestment. The other thing that would reduce the arrest and incarcerate pipeline is to end the school to prison pipeline. So we'd be calling for ending out-of-school suspensions and implementing a discipline process in the school that's based on restorative justice. So one of the things that you all did that was a really positive step just last year was to create an Office of Community Mediation. This is part of the consent decree in Ferguson as well, as seen as one of the major crime-fighting tools that we have, is that neighborhood mediators can go into communities and resolve conflicts before they turn into crimes. So we wanted to applaud the Board of Aldermen for this community mediation program, but we also wanted to note that almost all of volunteer staff besides the director. And in order to provide continuity to that program and have a good flow of professional mediators, we need continuity in that program, and that might require some more money. So the other concept is that it's youth who create a lot of the crime in our communities, and it's youth who need the investments. The Forsake of All study showed that we could reduce crime if we nurtured relationships between parents and children, if we taught conflict resolution in the schools, if we had adequate job skills training, youth mentoring, and strategies that address unemployment and access to quality education. The other part of this slide has to do with a program called Cure Violence, and we wanted to emphasize that program to you all today because we're looking around the country. It's had some huge success. So Cure Violence is a method of violent crime interruption that's based on a healthcare model. So the idea is, if you have an epidemic, a flu epidemic, or some other health epidemic, you find ways to interrupt the spread of that epidemic and reduce it over time. And the Cure Violence approach is based on the same type of model. So they do really two main things. They have what they call violence interrupters, who are mediators who come from the communities that they're working in, and they go out into the community to mediate issues around violence and de-escalate situations. So for instance, if there's a shooting, they might go talk to the family of the victim so that they can stop a retaliatory shooting from happening by de-escalating that situation. So that's the violence interrupters. The other part of the Cure Violence program is that they do outreach and hook people into programs, get people involved in job programs, getting their GED, etc., so that they can have more positive alternatives for their life. So there is a program already in St. Louis that's based on this Cure Violence model. Lots of times Cure Violence, besides being out in the community, they also work through the hospitals. And there was a program here that began at Children's Hospital where youth who came in who were victims of gunshot violence would be assigned a social worker who meets with them weekly for, I think it's a 10-month period. And they have shown that they've been able to reduce the repeat victims of violence by 10% at this point. So that program is being funded by a 3-year grant. It began at Children's and it's spreading to other hospitals, but we are very encouraged by that program and think that if it were linked into Cure Violence out in the neighborhoods, that we could have a huge success rate at lowering violence. Next. One of the programs that is based on the Cure Violence model that's had a huge success is in Richmond, California. They have what's called the Office of Neighborhood Safety, and this is hours that they've spent out in the neighborhoods doing community mediation, violence interruption. And the next slide. Over a 10-year period, they were able to have a reduction in gun violence of 71%. Huge reduction in their level of gun violence through the Richmond, California program. So this is a place where maybe you all can give us some guidance and some help, but we've been looking for areas where money might come from. We mentioned earlier that there's already been budgeted the 130 police officers that have not been hired, and maybe we can look at Derek Laney's going to talk a little bit later about changing the mission of the police that might help reduce the need for that 130 officers. So there's one source of money. But we've been looking at other places as well. And the business use tax has $18 million that's allocated for public safety and neighborhood programs. And also, I think it was $4 million on unallocated money. And we're not exactly sure how that was budgeted in 2019, so this is where we could use your feedback, but that might be one place, that $18 million, there might be some money that could go into advancing some of these programs. Okay. So Derek Laney's going to talk to us a little bit about how, in this new model of public safety, how does it change the role of police, and how would police fit into this new model?
Thank you, John. Good morning. Good morning. My name is Derek Laney. I'm with CAPCAR. And so we have talked about the need to reinvest in public safety and what does public safety look like, who does it affect, and how can we get those most affected people to have a sense of public safety. John also talked about some different programs that we might consider investing into to have a greater sense of public safety in St. Louis. What I'd like to talk about is what's really important is the people that we have put in charge of going out and ensuring public safety, the police department. How might that institution be transformed so that it delivers real public safety to all? The three concentric circles in the lower right-hand side talks about problem-solving policing as a model. So you have community partnerships where police would work hand-in-hand with community groups, neighborhood associations, governmental agencies, to help bring about public safety. You have problem solving as a guiding principle where police will go into communities and actually try to solve the problems. Keith talked about how do we prevent crime as opposed to going out after crimes have been committed. Problem solving is a key factor in helping to prevent crime. And then I think one of the most important aspects is the big circle, organizational transformation. So as it stands, today in St. Louis, there is a huge gap of trust between the community and the police. That requires a huge organizational transformation for the police. So one is when they start to use problem solving as a technique when they're on the streets, they get to have more decision-making power. So they're not given the mandate to just go out and crack heads and bring people in and continue the arrest and incarcerate model that has shown itself not to reduce violent crime. But they deal with immediate neighborhood issues, talk to people, and work things out. They work with those community partners, the community members, the neighborhood groups, and nonprofit organizations, as well as governmental agencies. And then the culture has to change within the police department, where there is a de-emphasis on arrest and incarceration, which, as we said, does not reduce this violent crime that we're facing, but work to do things like end the drug war and build community trust to close that trust gap and build more cooperative relationships, and then reward problem-solving techniques that the officers are using in their evaluations and in their promotions. If they're not rewarded for it, they're not going to be incentivized to use it. Next slide, please. Next slide, please. Oh, I'm sorry. And the problem-solving model transforms what we're currently doing. So with the problem-solving model, you take something like hotspot policing, and it is transformed into flooding these distressed neighborhoods with resources. Let me get, sorry, I'm messing up my thing. So flooding the distressed neighborhood with resources. And then you take something like broken window policing, and that turns into solving these minor crimes before they turn into solving the sources of minor crime before they turn into actual crimes. So broken window policing is going after any small infraction so that you bring the fear of God to the community so they know you don't throw down a stick of paper, you don't do anything unless the police are going to be right on top of your head. What we want to do is we want to fix the windows. We don't want to police broken windows. We want to fix those windows. We want to fix the street lights, turn vacant lots into gardens and play areas. These are some of the ways that's going to make people feel safer. It's going to create a greater sense of trust within the community for the police. And finally, solving violent crime is flooding neighborhoods with social services, interventions, much like the program that John Chasnow mentioned with Cure Violence, the violent interrupters. That is a really effective programming where you intervene before something gets out of hand, and then you have gunshots and you have deaths, and we want to get that before it turns into something worse. And then to solve the minor issues, the neighborhood issues, talking with and working with neighborhood residents, working with the nonprofits and all of these different groups. We have to understand that one person's safety leads to everyone's safety. We can't simply police the Central Corridor and the Central West End and make some people truly safe with a high police presence and then leave the rest of the community in unsafe conditions and having to fend for themselves. So our presentation today talked about the need to reinvest in public safety. We are facing some serious and dire concerns about violent crime, so we have to spend our money wisely in different areas. We talked about what does it mean to be safe, who is safe, and what are some ways that we can think about public safety that doesn't just rely on heavy-handed police presence. And we talked about some programs that really do work, as well as transformation of the police culture and how they exhibit themselves in our community. We think that all of these different presentations, all of these different ways of looking at public safety will lead to a safer St. Louis for all of us, and it will drastically reduce violent crime. We thank you for the time. Thank you.
So we just wanted to see if there's any questions or clarifying information that you have. But I do want to emphasize that a lot of times people see things on paper and it looks really, really nice, and that's not the way that it operates in our communities. And so, I think that's been a problem, because then people say, oh, we got this, already got this program, but the way that program is implemented is not helping. The other thing that I would emphasize is that in many ways, the police department gets incentivized to continue the way that it operates. And so, for example, the way that SWAT was originally envisioned is not the way that it's being used now, because basically there's no need for a SWAT like there was when it started. And so now SWAT is being used to warrants. I mean, really, that's what we're using it for? But then there's federal dollars that come if you use SWAT and you use these programs. And so people say we got to have it because we're going to get a federal grant. And what we're saying, we need to rethink all of that. If we are saying we don't want that kind of heavy-handed approach, we want a transformational approach, then that means sometimes we're saying we're not going to accept that grant, or we're not going to take that money.
We can open up for questions from members of the committee by seniority. Alderman Boyd.
Yes, thank you so much for your presentation this morning. I have several questions. I'll try not to take up everybody's time because I just want to make sure I'm clear. It's very informative, and I think it's impactful. It gave me a reason to pause and really think about some stuff. But my first question is, you talk about recreation centers. We need more recreation centers. What have you found are the barriers to young people accessing our recreation centers? I know in the 22nd Ward, I have the YMCA. They provide grants for low-income people to be able to come, basically free, almost, low cost at the highest. We have Woles Center right there at Kings Highway and Martin Luther King. So I'm just using what I'm aware of that's close to where my constituents would take advantage of. I'm not hearing overcrowding at these centers. So what are you finding as barriers for access?
So a couple of things. One is that in terms of the YMCAs, and particularly the two in Carondelet Park and Penrose, is that people don't know that there's those kind of grants that they can take opportunities to do. So that's not widespread, even as long as those rec centers have been up. People see them as private, and therefore, if they don't have any money, they can't come. The other thing is some of the existing rec centers are understaffed and have very low-level programs that really don't attract youth. I mean, I'm just got to be very clear about that. And that's been going on for some time. So if you bounce a ball and play basketball, maybe there's a place for you. But for other things, I just think the rec centers haven't kept up with the changing needs and interest of the population as, say, maybe the public libraries have. They become very diverse in the way that they bring people in. The other thing is the safety issue. So it used to be that you just go walk somewhere. That's parents don't want their kids walking like that anymore just because of safety. So if it's not a place that's in maybe 4 or 5 blocks walking distance, then there's really no place for those kids to go. And I think even if there are parks that don't have a rec center attached to them, those parks aren't really that safe either, because sometimes that's the place where people, like, create their business opportunities for drugs and that kind of thing. So I think the whole youth recreation piece needs to be a look at it. And we actually would like some of this money that we talked about to go into parks and recreation to actually beef it up in terms of what young people want to do these days.
Yeah, good point, because I have heard some of those barriers of maybe the parks doesn't feel safe, like Margaret Anderson Park right there at Clara and Martin Luther King, Amherst Park, there's shootings or drug activity. But then again, on the flip side, those are low-level crimes, quote unquote. So how do we reconcile going after drug dealers that are sitting in the park, causing, parents to pause, they're sending their children over there, to arresting them for quote unquote a low-level crime or prostitution going on in the park? I mean, how do we reconcile all of that? Because we can't leave a police officer, and no one wants to see a police officer at the park every time they come, or the park rangers, because then the appearance is it's not safe to go if you have to have a police officer there all the time. So how do we reconcile dealing with the negative behavior that's going on in the parks and making them safe and making the community feel comfortable going to the parks and recreation centers?
So I would say that my part of the presentation about problem-solving policing is that we have to look at people who are engaging in those activities not as criminals, but as people who are responding to the environment that they're in. If you don't have enough money to take care of basic needs, then you will resort to perhaps selling drugs or prostitutions or things of that nature. If problem-solving, the transformation brings problem-solving policing to our neighborhoods, then we can say, what is going on in your life that this is a choice for you, and what resources can we bring to bear to help you find alternative, non-law breaking choices? And then people don't want to be criminals. People want to get the things that they need in their lives. If we provide them a way to get those things, then they won't engage in the criminal behavior.
And whose responsibility is that? Are you saying the city should fund more organizations to mitigate those type of issues?
Well, with problem-solving policing, that one slice of that responsibility is the police. It is their responsibility not to go and run folks off or arrest them and incarcerate them, but to help them be connected with those other groups, community groups, nonprofits, governmental agencies that can help fulfill those needs that they have.
The other piece is the community. So as you're talking about community engagement and community involvement, if people understand what they want for their neighborhoods, then they're going to find ways to engage those young people. And most of them, we're going to know. I'm going to say, Jesse, you need to take that stuff on down the street. We got babies here playing. Somebody knows those folks. So let's not act like these are strangers coming into the neighborhood.
Right.
And so people have to feel emboldened and empowered to say, no, these are the playgrounds for our kids. Now, if y'all want to do all of that, can't necessarily pull it together the way we want to, but right now, this has got to be safe space for our children.
And I agree with you 1,000%, Jamala, because that is personal responsibility, and that is something we as community members should be doing, and not tax the police what happened to do that. Because if we expect the police to carry pamphlets and follow through with people they engage with the negative activity, not having to arrest them, which I'm really excited about Kim Gardner's diversion program. So when they do get arrested, they have a second chance or maybe a third chance. So I think we're making some good steps in this cycle, to end some of the mass incarceration. But if we don't have willing participants, and if we don't have residents in the neighborhood that are willing to say, hey man, you can't sell drugs across the street from me because I have a family. And because I've lived my life like that. I had to deal with drug dealers. And I would tell them right across the street from me, it looks like you're selling drugs. You haven't sold me any, but they're going to come and get you if you keep doing it. And I'm going to be one of them in the tails, and a whole bunch of other people. But until we have the courage to do that, it's difficult. And then not having trust in police, they don't want to call the police and say anything because they think the police are going to tell that they called because they fear of retaliation. So it's a whole cultural shift that we're going to have to make. But everybody has to do their part in that space. The police has to do their part, and we have to do our part. But that's the hardest part.
One tactic that I used to use, not as much as I used to, but I would have a trash bag. And when I see those young people, I say, can y'all help me pick up some trash around here? So that, they gonna do it at that time, but they ain't gonna be hanging around the next time they see me because they know I got some work for them to do.
I wish we had more people doing that because it works. It really works. It's all about how we communicate with one another. You also talk about 37.1% officers. We have 37.1% officers per 10,000. But then I have constituents that are complaining that when I call the police, they never show up. I mean, that's a classic. They never show up. They never show up. And then so we ask, why don't you show up? What are you doing that it takes you 45 minutes because I call, my house has been broken into? Because of how they prioritize, you know, the calls for services. So on one hand, in your model, in your presentation, I can say, oh, wow, that on paper, it looks like we have an abundance of police officers. We don't need more police officers. But when you have constituents that are calling you, telling you it's taking way too long for the police to respond, we don't have enough police officers. So I'm trying to reconcile in my brain, you know, what's being said and what actually happens in the community when it comes to police response time.
I think we both jump into
I'll say one thing. So you do have police officers showing up for a panhandler in the Central West End, which is not life-threatening, which is not a huge problem in the scope of things. Those police officers that show up for that are the ones not showing up for someone getting shot at north of Del Mar. So it is a priority, not a question of the number of police. If the priorities were that the people north of Del Mar were as valuable as the people south of Del Mar, then you would see some different response rates.
Okay, so can you quantify that data? Because I'm very interested in that. Because when I speak to the police, they talk about how they process. So the panhandler is probably going to be 2 hours getting to, from what my understanding is, than the person that was shot or stabbed or there's a fist fight.
They're constantly.
Okay.
They're constantly.
Okay,
those small,
and
broken window-
I accept that. I'm just asking, do you have any quantifiable data that we could?
We could get it for you.
I would really appreciate that because I want to use that to, you know, help make things better in my neighborhood.
I think we can try to get that, but the other thing is anecdotal, because I can tell you from being in the communities of color, that's the most common complaint, that they never come or they're late coming. I don't hear that when we go to predominantly white wards where the folks show up because they're expected to show up. So I think there's a different expectation of what happens in our community, and everybody responds accordingly, including the police, that these communities aren't worth whatever. And so if we get there, fine. If we don't, and so what, that somebody's car got broken into? That happens all the time. So I think that the disconnect is what we're saying needs to be reconciled, and a lot of times it's based on people's attitudes and also, as Derek said, the priorities of what people are going to be responding to.
Okay, next one, the public safety budget. So you showed 52% is dedicated to arrest and incarceration. Is that the public safety, or is that the police department? I want to be clear.
So I could get you, we have the list of all the agencies we looked at to get that total, but that was the entire arrest and incarcerate model. So it's everything from the jails to the part of the city councilor's office that's dedicated to policing, to the circuit attorney's office, to the juvenile detention program. So it's the part of the building maintenance that goes to maintaining police buildings. So it's all of that. We could get you that list.
I'd really appreciate it. I just want to make sure I'm putting everything in perspective. Because I know, like the pensions, for example, with the police and the fire department are outrageous. And we've had to lay people off because we have to try to keep up with the pensions, you know, costs, which throws that budget out of whack. So then I'm looking at, okay, where are the personnel? You know, how many people do we have employed actually dealing with this cycle? So that would be very helpful. Okay. I just want to talk a little bit about some of those small, low-level crimes that I get beat up on a lot, which is prostitution and drug dealing. So they're considered low-level crimes. And you talked about mental health. let me assure you that we are suffering a mental health crisis in my neighborhood because we have to look at this every day. We have to look at women throwing their dress up and showing their naked bodies. I have a 5-year-old granddaughter. My children for the past 20 years have experienced all of this. And Jamal, I know you know what I'm talking about because you're over there all the time. But that's low level. That's low level. But we in my neighborhood cannot continue to just sit back and accept the fact that people are saying, oh, that's a low-level crime, and we'll get to it when we get to it. Now, I'm smart enough to understand that we have to humanize these women out there, and men, because we have men out there prostituting too. And we have to put a real face with what's going on, and we need to help them, and we need more programs to help them. And that's something I know personally I'm proud to say I am working on. And I know it's going to be a tough work in progress, but there are a lot of agencies out there that can help people. But in the meantime, we cannot continue to just have them running around the neighborhood making us feel bad. Can somebody talk to me about that a little bit? And the drug dealers, because they're petty, some of them. But see, the drug dealers are feeding the heroin to the prostitutes that are out there, and then they're sleeping in the vacant houses, and sooner or later they go up in flames. You talked about, you know, being prevention with fires, but we got to keep all these vacant buildings screwed down with almost metal, if you will, to keep them from going in it to seek shelter. So that's a social problem it's small, petty kind of, if you will. That's what people keep telling me. It's just this low-level crime that is causing a huge psychological, just damaging to our psychic in our neighborhood, and we need to do better with that. So help me with that.
So
Where our
I would
resources need to
say
be.
that even still, when you look at getting to the root of that problem, because I remember we had some discussion in the Organization for Black Struggle about what to do with the prostitutes in terms of our women's division and what that would look like. And because most of them, as you say, are women who are on drugs, then that means that they need to get drug help. But when you start looking at the availability of drug treatment programs, they're not that great. And so you also have, both in terms of the prostitutes and the people that are selling drugs, a disconnect from a broader society, because this is basically like living under the radar kind of thing. So it's going to take a minute to get them up and running to be part of a job environment. And so it's not like, okay, you take the drugs away and you send them to job training, everything's going to be all right. Those people are going to need some intensive care because some of them have been doing this since like teenagers. And so, yes, I think if we talk about getting to the root cause of the problem and not to like, how do we deal with like boarding up the houses, that's important, but we don't even have outreach to these women or to the drug dealers for that matter. And I think in some cities they actually have some of that, even if it's just means giving them condoms or needles. I mean, we have none of that here. And so I'm saying that piece of it, people hope that they like stay out of their sight, but as you know, those folks are in sight. Every time you go down the street on Hold'em, they're in sight. And so they're not going away. And so I think that once we put our heads together, I'm pretty confident that we could come up with some ways to reduce and get some of those people into some meaningful job opportunities.
But it's serious. I mean, we need to do that ASAP. Because it's very troubling in our neighborhood. I want to get a better understanding of.
Jeffrey, do you mind if I weigh in on that a little bit?
Go right ahead.
So I date myself a little bit, but in 1969, I volunteered at the mental health hospital on Arsenal Street. And while I was there, I saw the deinstitutionalizing efforts that went underway in 1969. So essentially the idea was, let's empty the mental institution of everyone we can because we've institutionalized these people. And the result was we just dumped people on the streets and never came up with decent programs. And we've been suffering in homelessness and drug addiction and prostitution, everything else ever since then. So I've watched this for a long period of time. And I sometimes feel like you all are like the CEO who is only accountable to the next quarterly report. You know, you don't get to often take the longer view because the short-term problems are so immense, and I sympathize with that. But I do think we have to look, where do we want to be 5 years from now, and not just deal in the very short term. But we also, I think you're right to say it has to happen ASAP, and that means taking money from something to put into these programs that we know we need to have. And so we just voted to finance a new headquarters for SWAT. And Jamala mentioned SWAT, so I just wanted to throw out some statistics. I did a sunshine request, and over I think it was a 5-year period, there were 1,600 deployments of SWAT. And out of those 1,600, there was less than 1% that dealt with what we think of as SWAT, which is active shooters in barricaded situations, hostage situations. Less than 1% of those 1,600. And there were only, so then you look at high-risk warrants, which is the other main use for SWAT, high-risk warrants. Out in those 6 high-risk warrants, there were only 3 incidents where people shot at the police. And so we have almost, 1,600 cases and only 3 where people shot back, but we're labeling all of these as high risk. And so I think we really do, it's difficult to look at the police budget, and it's maybe not politically popular, but we do have to look at these things and see what are we getting for our money and use that money for more productive purposes.
Thank you. Talk to me about, is it Derek, right?
I'm Derek.
Because so you talked about in the drug war. What does that look like? What are you really talking about?
Well, the drug war came out of, was the late 70s, and there's evidence and there's records to show that it was basically an attempt to apply mass incarceration to the African-American community, that it was not an attempt to curb drug crime, but more to reduce the voting bloc of black folks. And so it has not had any of the intended effects of reducing drug crime. It has the effect of just increasing the mass incarceration of African Americans and brown people. What does ending the drug war look like? The ending the drug war looks like some of the things that we've mentioned about adequate drug treatment resources being applied. It means following up on Circuit Attorney Gardner's prescriptions of lowering the thresholds for arresting and incarceration for marijuana possession. It looks like, increasing treatment, and it looks like just really, I think, looking at legalizing a lot of drugs, decriminalizing and legalizing. Some drug use, like marijuana use, is victimless, and you create the black market by making it illegal. When you take away that incentive for the black market, then people will just use it for their own recreational purposes or whatever, medical purposes, and it won't become this criminal activity that it is now, and it won't require the incarceration, the arrest, the huge use of police resources to follow those laws.
Okay, I just want to make sure I was clear. So now I have a better understanding. Let's just focus on marijuana, which I think the city is moving in the right direction. Would you agree on decriminalizing marijuana and the whole
but
state
in Europe, in some countries, they have decriminalized all recreational drugs, and what they've replaced it with is intensive treatment. Yeah. So you treat drug use not as a public safety issue, but a public health issue. Right. And people don't need to go to jail because they have a drug problem. They need to go to treatment.
Right, and there's a difference between recreational use of marijuana and heroin. Would you agree?
There's a difference, but both of them, I believe, stem from the same deficit that people feel inside, and they're trying to fill it with some substance.
But would you suggest that we legalize heroin?
I suggest that my personal opinion, not CAPCAR's necessarily, since we have not gotten any consensus on this, but my personal opinion is that you decriminalize all recreational drugs. Decriminalize them meaning that you don't go to jail because you have a drug problem. That is a sickness. It is a diagnosable illness.
Yeah.
You get treated.
But you're not also, stealing your mom's TV and putting it in the pawn shop because you're smoking marijuana. But you're probably doing it when you're doing all these other drugs, which I wouldn't consider recreational. I would not consider heroin a recreational drug. It's probably a painkiller, if nothing else, but I would highly doubt that it's a recreational drug. And I just want to make sure that my position is clear. I'm with you when it comes to decriminalizing marijuana, but I want the drug dealers off the street in my neighborhood selling heroin and making, basically keeping these individuals dependent upon them, and they're out there doing prostitution and they're breaking into people's homes. We must do our job when it comes to drug dealing, and I want to be clear with that. And I would like all of them incarcerated.
Okay.
Okay?
Well,
I'm
speak to
willing
your
to,
point.
wait a minute, I'm willing to be proactive though, and we talk to Johnny and say, hey, look, you know, there's a better alternative. But you know, we also, let's not be so naive, and I'm not, please don't take this the wrong way, to think that everybody's a willing participant, because you have to, in order to be successful with your model, with your program, you have to have willing participants. You absolutely do. And those we can help, we need to make sure we put them in the system and give them the help that they need. But you know, there are a lot of them out there who just don't care. And they're going to keep selling drugs, and they're going to keep poisoning and killing our community without impunity. And that's not acceptable.
Well, one of the things I would say to that is that those who are stealing and pawning their mama's TV, that is a symptom of the disease of drug addiction that they have. It is not.
But they
So
get
let
their
me
drugs,
finish.
Derek, from
It's
somebody.
a crime, but it's a symptom of the disease they have. The other thing is, following your logic that they just need to be taken off the street, that arrest and incarcerate model has shown itself not to be effective. And what will happen is when Johnny gets taken off the street, then Sammy takes his place. You
Exactly.
cannot arrest your way out of this problem. What you can do is find ways to help people find solutions to get what they need rather than taking that route.
I'm with you on 80% of what we're talking about, but I'm just saying, I want to make sure we're clear that there's some that are not going to be a willing participant, and we should help those. We should be proactive in helping those that are out there selling drugs. But what drives me crazy, what you just said, okay, they pick Johnny up, they get replaced with Tim, and they pick Tim up, and they just keep being replaced. And we do need to stop, interrupt that cycle. So I'm with you on that. But I'm also saying we can't just accept it as just a low-level crime where we just keep picking them up and picking them up. Because here's what happens in prostitution, and this is what I, get beat up a lot about. So they pick her up for prostitution, they take her to the system, and she comes right back out. Why? Because she's entitled, or he's entitled to due process. The community is outraged about it, right? Because they keep saying, we need to get them off the street, we need to get them off the street. They come right back. And if you check the records, some of them have like 8 different court dates for prostitution. So at some point, we have to do better than what we're doing, and we are attempting to encourage them. But I don't want to support a system where you just, your overall strategy is to just prevention, because there are a lot of them that are not going to care. And I'm telling you what I know. I have grown up around this in the Hamiltonized neighborhood for over 28 years. And I've seen some of them get their life together and they're productive citizens of society. And I've seen a lot of them go to jail and come right back out and do the same thing. So I want to be proactive, but I don't want, to seem like this is going to be some warm and fuzzy strategy that the city is coming up with to save everybody.
So what we're proposing is something that's new and different and that has not been tried but we've seen it have very positive effects elsewhere. What you're proposing to continue to do has been happening those 28 years you've been talking about and hasn't solved the problem.
But not to everybody. I want to be clear. Those who are repeat offenders, we cannot continue to just give all these chances. I 100% support Kim Gardner and her strategy about the divergence part. So I think the city is really moving in a direction that you're looking for us to move into with funding strategies like Proposition S money, public safety money, and other pots of money to fund Better Family Life, who's doing a great job with de-escalation and so on and so forth. But I want to make sure we're clear. There are some people that we're not going to be able to help. And we need to get them off, because to me, they're the parasites. The ones that want help, let's help them. But those that will just continue to do no matter what you say, and let's keep it real, there are really people out there who don't care about my neighborhood.
So I think.
I'm passionate about this,
Yeah,
guys, but I'm
well-
not beating you up, because I think we're on the same side with this. It's just that I don't want to lose sight of, there are some that got to go.
Well, I think when we start to look at it in the long view as well as the holistic view, then we'll see that the number of people that you deem as really don't care are really a small percentage of that. Most of these folks, and some of these folks, we've seen them close up because they're in our families. What happens that they drop off and start doing these things? It's some very specific reasons, and some of it goes back to the slide about what young people need. And if they didn't get that, then they're going to get it wherever they can. And so I think the drug piece The face of drugs and drug addiction is changing. I mean, you know, now crack cocaine is not the big seller, it's like opioids.
Right.
But I'm saying we haven't even kept up with all of that stuff. And so I think once we wrap our heads around what does it look like for us to do drug prevention, drug intervention in our neighborhoods, then I think the outcomes are going to be much better than what we anticipate.
I'm gonna end it on this. Do you think the city is doing a decent job moving in the direction that you would like us to move into as we interrupt this cycle? I know we can do a better job, but I'm just...
You could do a better job, but I think one of the things that's probably not clear to our communities is what is the plan?
Okay.
I mean, so we know it in very small pieces, like we doing this here, and I hear about, all the Woman Green's thing around marijuana, but I don't think there's a plan that's come out of the board to say, here is what we're going to be doing over the next 5 years.
Okay.
And we need your participation in helping it to be real and to be effective.
Thank you. I really appreciate your presentation. It was, again, eye-opening, and I'm very supportive of 90% of what we're trying to do. I just need some help in my neighborhood. I want to feel better, I want my family to feel better about living there.
Alderwoman Spencer, do you have any questions?
Thank you, Mr. Chairman, and thank you all for being here today. I agree that this was a very informative presentation, and it's refreshing to hear some positive, forward-thinking ways of changing the public safety dynamic for our city and our region. I was really impressed with some of the data, and I had some questions on to clarify some things. St. Louis being the 11th most policed city in the United States, one thing I've noticed in looking at some of the FBI statistics is that not only are we heavily policed, but many of our police officers are not actually on the streets. They're not working with communities. They're behind desks and that sort of thing. Is that something you've taken a look at and noted? Because, I think police officers can be effective when they are part of the community and working with the community rather than being, behind the scenes.
I don't think we have the statistics at hand, but we hear the same thing constantly. We have so many white shirts, we don't have people
Yes.
out on the streets, and we're a top-heavy department. And I think that really does need to have a serious look taken at that. It might not be a problem we can solve overnight, but as people retire, we can look at what positions really need to be refilled.
Sure. I would just encourage that, looking at that to be part of what you're doing, because I think it's a really important, crucial piece. If we can get more officers engaged in a positive manner outside of the, halls, the walls of the police headquarters, that could really improve some things. The cities, the other highly policed cities, the 10, I suppose, that are higher than St. Louis, I'm curious to know if they have higher or lower crime rates than St. Louis, and subsequently, if they are also making significant investments in the human capital that is their citizenry, in addition to the high investment in their policing. Has this group looked into any of that?
No, it's a really good question, and so we have just developed a research working group, and I will pass that on to them because I do think you're right. That's a serious question.
Yeah, I appreciate it. I mean, I'm sure you know that here at the Board of Aldermen, we don't have a research group. And so while we don't have any staff hardly at all, we have shares. So any research you could do on this subject matter, which you're experts in, would be very, very helpful and useful to this board and specifically this committee as we look at moving us forward in a more positive manner. The Baltimore study, I see you have a link here. If this is something you could send out electronically, I think it would be very helpful. I'd be curious to read that study. I don't know the title of it, and I don't have this electronically, so I'm unable to use the link here in the presentation, but I was very curious about that. And then I want to turn to the marijuana and the arrest rate here. I was curious, the slide that described the arrest rate for African Americans for the use of marijuana being 18 times higher than that of whites. Is that a rate that is that a statistic specific to St. Louis, or is that a national statistic?
That one was specific to St. Louis.
Really?
But there are comparable high rates across urban areas.
Okay.
Well, I wouldn't say comparable because it was one of the high rates, but across the country, I think the rate was something like 3 or 4 times higher.
Really?
But ACLU did this study county by county.
Really?
And so
Yeah.
we could get you that ACLU study too.
Would you do that? That is really an incredible disparity. I'd be curious to know, too, how that may or may not have shifted after the decriminalization bill ordinance was passed here in the city of St. Louis, I believe in 2014, if that made a difference at all, one way or the other, impacting that disparity. So if there was any longitudinal data on that, I would be curious to know.
Alderwoman Spencer, recall that I've said that the AG office does this every year for all of the jurisdictions in Missouri. And so St. Louis has been consistently high in that way, and the disparities really stark. And so it's not been that much of a decrease since then.
I would just be curious to know if it worsened it or maybe improved it, or if we could take any lessons from any shifts that's happened from that. The reason I'm asking, too, is going into my next question, passage of State Amendment Number 2, sort of the legalization of medical marijuana, how that may or may not impact that disparity, and how we can maybe make some inferences or take some lessons from the local decriminalization here as one step towards that, and how you may see the implementation of the Amendment 2 having an impact on those figures.
I don't know that the Amendment 2 is going to have a whole lot of impact. Maybe some of my colleagues might differ, and that's because it's still medical marijuana, and you have to go through a particular process to do that. It's not recreational. But I will say that even given the difference in the drug policy that's more realistic and more open to what the reality is, it's still a disconnect between policing. So even though there might be a plan that says if you have one, whatever it is that you can have without it being illegal, if you got police officers that are targeting young black men, then obviously those rates are going to be higher. And what we found out, not even just the amount of arrests, but the drug use between blacks and whites are comparable, but yet ours is, that many times higher in terms of arrests. So that's not just a drug policy, that's a policy of policing. Mm-hmm. And that's why all of this stuff is together. You got to look at it in a holistic way.
Mm-hmm. In addition to looking at, when we go back to policing, and, you point out that budgets really describe the priorities of an organization. I agree. I'd like to look at some of those other cities, the successful cities, because not only do we have a very high amount of money per capita going to policing, but it's a very high percentage of our overall budget, especially when you take out the enterprise funds that are sort of untouchable. And I'm really curious to look to see how St. Louis stacks up to other cities with similar demographics, because we have to compare apples to apples. We do have a high poverty rate, which really can drive down our income for our city. And so that high number of dollars we spend becomes a higher percentage of our overall income. And so that is an even bigger disparity. It could be when looking across the country at other cities. So any other comparisons along that line would be helpful, I think, to me. But going back to the budgets, I'm curious if you all have spoken to the mayor's office and had the same sort of presentation, because as you know, the budget for the city of St. Louis is largely set by the administration, and it's okayed by the Board of Aldermen, but when it comes down to it functionally, we have very limited capacity and authority to drive those decision-making. And even though the Board of Aldermen, I think everybody here, especially in the Public Safety Committee, would like to see more community policing, but the reality of the structure of our government is such that we have very little power to enact something like that. This is a structural change that would require, the initiative to come from the administration. We can advocate for it, and I think most of us would join you in advocating for a complete cultural shift. But functionally, we are very limited in how we can implement such a shift.
So we have been making our way through the Board of E&A. We have met with President of the Board, Louis Reed, and Comptroller Darlene Green. And we have yet, I've been in a conversation with the mayor, but we've yet to have a meeting to address some of these specific issues with the mayor. However, I wanted to go back and talk about that question of budgets being priorities, which is really important, and it shows what our priorities are. However, we have had the past, 6 police chiefs say that we cannot arrest and incarcerate our way out of the violent crime that is happening in St. Louis, yet we continue to invest in that very same notion that we need more police, we need to arrest more people, we need to incarcerate more people. So it becomes a question of common sense. If we do the same thing over and over and over and not see any results in the reduction of violent crime, perhaps it's not making sense to continue to invest in that and maybe invest in some of these evidence-based programs that we're suggesting.
I would agree. And again, I don't think, those of us who are sitting here worked hard to get into our seats, and I don't take lightly the admission that we don't have as much power as we'd like to have. But frankly, when it comes to making a major shift in public safety, we need to have partnerships across the city to make that happen. And we are ill-equipped at the Board of Aldermen, I believe, to be the sole driver of such an enormous, much-needed positive change. I do appreciate you bringing it to us because I think that, like I said, the majority of us really agree with you and support your efforts here. And thank you for your continued service and work to try to drive this conversation in our region.
And so I would just add to Derek that I think all of you all have power to advocate and use your positions as bully pits because you have constituents and you are trying to create a different kind of vision in your ward. And so that is the person that all of these folks in the Board of E&A look at because they're elected positions. And so the folks that they going to hear from are folks in you all's wards. And so I think that there are a number of groups, not just CAPCAR, that are looking at how do you make some meaningful change, and again, not keep repeating the same thing over and over again, because if you live long enough, you see that, okay, in 1969, we saw that didn't work. Now we in 1990 with some stuff around crack cocaine, that didn't work. What are we doing? We are supposed to be intelligent beings that are looking at a situation and say, okay, where do we take this from here? And we kept making reference to the forsake of all. I mean, we said Dr. Jason Purnell, who's become the face, but it was 3 universities, local universities that did a 2-year study of how violence affects everything, health, education, the way our communities function. And so there are different ears and eyes and minds that are trying to wrap their heads around what could it look like for this region who's already had a combustible moment with the Ferguson uprising to say, those are the things that feed into that kind of combustion. And what are we going to do differently going forward? So I think one of the things we're looking for is to be partners with you all as we look at a long-term plan to say, here's what we could do in 10 years. And in order to do that, it's going to have to start with the budget reallocation and how we're going to get people, because folks are already there from what we could tell when we did our town halls. They're looking at ways, okay, yeah, we see all that money that's being spent and we can't get a police to come to our house to deal with something. So people are ready for a change, and they're looking to the elected officials, they're looking to social justice groups, they're looking for the universities, and we all are thinking about it. We just need to come together and create a plan.
I agree completely, and I encourage you to continue to moving forward through other channels of government as well. But I would like to add just that I think many of us here are supportive of what you're trying to do. So thank you for being here today. That's all I have, Mr. Chairman.
Thank you. I know Alderman from the 21st is Jessica. He was in another committee hearing that was going on at the same time, so he may have some questions after he had a chance to go through the material for you.
And we are available.
And we have several other alder people who are here. If you had any questions or comments, I know the chairman of Ways and Means just walked in, but he's the most senior out of the others who are here.
That's where all the money is.
Then we have Alderman Gunther. Did you have anything? Alderman Rice? No question. Okay. Then with that,
Follow-up, no.
the Alderman from the 22nd has a follow-up.
Yeah, so, Jamal, I hope we living in the same world, because you said ENA, our constituent, will be calling them about issues. They never call the mayor's office. They always call me. I asked them to please call the mayor's office about some of the problems, because they all work for the mayor. I wish they would call the president of the Board of Aldermen and the comptroller, you know, but we're the first line of defense, and they always call me. You know, and I think,
Appropriate. You said you're the first line of defense. That's
Right.
appropriate. But then you need to be telling folks in the board of ENA, here's what I'm hearing from my constituents. I've had 500 people call me around this issue, and I need some relief here.
that's why I'm always talking to room 200. Amen. But I just want to make it clear, you know, they calling us first. I hope they spend more time calling them. Also, Jamal, in your experience, and you've been doing this for a long time, you've seen a lot of studies. You've seen a lot of studies that the city have done. You've seen a lot of studies that the university have done. One of the things that I would like to encourage the university to do is to put their money where their research is. Have you seen or know of any university that actually did all this research and funded a program and actually saw what was on paper materialize?
So I think the fact that there is now an office that Dr. Purnell is heading up means that there was some amount of commitment to taking the study and making it real. But again, that's, and I haven't talked to Dr. Purnell recently, but one of the things that it has to do is you have to bring in the private and public partnerships for this stuff. We got a finite pie here in the city. That's why we said we got to reallocate. No more money's coming. You know, and if it is, it's just going to be icing on the cake. So we're trying to look at what do we have, what are people willing to do, but part of it is the persuasion piece of getting somebody at a Monsanto to understand what their role and relationship is to what's all going on, and that if we don't do something, then they're not going to have healthy, happy employees coming to them, or that the amount of money that it's going to take for taxpayer drain because we're trying to fund the prison system with 2 million people across the country. That's the kind of persuasion that has to be done even at that level. And I don't know who's talking to the business community. I know we don't run in those circles, but maybe somebody who's got their ear can begin to talk about what their role in this is. So there's a role and a stake for all of us. We're all stakeholders in this democracy.
Okay.
Also, the program that John referred to, the 1.68 million over 3 years with the hospitals, those hospitals are connected with universities, and the research that the universities have done have informed those programs. So they are actually implementing efforts to reduce violent crimes among young people.
Outstanding. And the last thing, 'cause I know you're ready to go, Jamal, I want to invite you to sit down and have conversation with me, since you are in that neighborhood down the street from where I live, and see what strategies may work in the 22nd Ward. I mean, the aldermen don't have access to like block grant money like we used to and kind of fund, special initiatives and whatever, but it's important to me that if there's a model that works and that we haven't tried it, even if we don't know if it works, but we haven't tried it, I am very interested in trying it. And I mean that sincerely, because we have to make a change. I've seen a neighborhood that we've lost hundreds of buildings since 2003.
And citizens and voters.
And so people need to feel safe. And the whole point of this is a public safety presentation. And the only way you're going to get investment for your infrastructure and rebuilding housing and bringing people back is to make people feel safe in those neighborhoods. And that's a huge task and undertaking. And I think I speak on behalf of all aldermen. I say we, as one person representing a ward, can't do it by ourselves. Absolutely can't do it by ourselves. So I want to invite you. You have my numbers, emails, call me, let's sit down and talk about some solutions that we can actually work on together and make some substantial change.
If I could make one final appeal, I'll try to be quick. So we've tried to be very data-driven, and you all have asked us to do research on to some of the other questions that you raised today. And one of the big blockades here is that it's very difficult to get information out of the police department. Our sunshine law really doesn't work very effectively. We often wait 3-4 months for sunshine information. And I don't know if you saw the recent article, but one of our allies asked for the police budget in February of 2018, and just got it a few weeks ago. So if you all can help us in any way, open up, shine the light of sunshine on the police department, that would be huge. If you could help us get an accurate budget from them or as they make their proposals for the coming year, that would be hugely helpful.
All right, we could speak on that as well. Okay.
Quickly,
Yes.
and I just wanted to invite all of the alders to possibly bring this conversation into your ward organizations, into your neighborhood associations. As Alderwoman Spencer mentioned, that there are a few things that the alders can do, but one of the things is driving that conversation. And so we are more than welcome to bring this PowerPoint, bring this discussion and this message to any and all groups in St. Louis.
Okay. Well, I believe that we do appreciate your coming. You didn't have the PowerPoint at the budget hearing, but your conversation I felt was interesting enough and provocative in terms of our thinking enough to bring it to the Public Safety Committee. As you see, it was both appreciated and provided some new perspectives and ideas and at least generated a different kind of dialogue around this issue. We appreciate your coming. I'm sure we'll be asking you back on some other points. And so then thank you for your presentation today. Thank you. Thank you. That completes the agenda for the Public Safety Committee today. Seeing nothing else, our meeting is now adjourned. Thank you.